Hi everyone, welcome to Doc's Thoughts. So I want to talk today about food sensitivity testing. Before I get into that, I want to say thank you to all of you who have been watching my videos, and some of you have actually sent some messages to me asking me to talk about certain topics. I love that, and so keep doing that. If I haven't gotten to your topic and I've told you that I'm going to, it just means that I haven't prepared for it yet. So sometimes for these videos, I'll do a little bit of preparation or education before I present. So thank you for doing that. And if you have any messages, you can always send them to us on Instagram, through our Facebook Messenger. You can send them to courses@lynnkwagner.com, courses@lynnkwagner.com, and we'll get to them as soon as we can. If I don't think it's a topic that I want to address, I'll just shoot you a message back and say, sorry, I'm not going to do that one. And I know you'll understand. But anyway, so regarding food sensitivity testing, so patients ask me this every single day that I do clinic. They say, hey, Dr. Wagner, should I be doing food sensitivity testing? If you don't know what it is, it's a kit that you provide a blood sample, and then the company tests for certain antibodies in your blood. There's several different types of food sensitivity tests, but that's kind of the gist of it. It can either be a serum sample, meaning they take it from your vein at a regular lab, or some of the kits you can actually collect the blood on your own at home by poking your finger and then dripping some of your blood onto a card. They both work really well in terms of their utility. They're testing for, most of the time, antibodies in your blood. So it's different than having a food allergy. A food allergy means that you actually mount an allergic response to a food. That testing needs to be done through a regular allergy clinic, and it means that you should never eat that food if you're allergic to it. So it's similar to bee stings or being allergic to peanuts. Like, those foods are no, you should not eat those. Food sensitivity means that we're finding more antibodies in your blood. And the short answer to the question that my patients ask me when they say, hey, Dr. Wagner, should I do food sensitivity testing? Most of the time is no. And I think people are shocked about that because it's very common. We see these kits on Walgreens. There's lots of providers that are offering them. But at the end of the day, what I tell my patient is, first of all, if you're reacting to a lot of foods, the food probably isn't the problem. You probably have an underlying issue that needs to be addressed. So it could be that you have a histamine problem, or that you have a gut problem, dysbiosis, leaky gut, that your immune system is out of whack. And so by targeting those things instead, you often can get away with not having to do the food sensitivity testing. What I find with people who are doing some of these food sensitivity tests is people are developing food fear. So they'll do a test, they'll get some positive scores for certain foods, they'll avoid those foods, and if they haven't addressed the root cause or the problem, they'll still have symptoms, and they keep thinking that the food is the problem. So they'll repeat the test, they'll find more foods that they're allergic to or reacting to, and they'll keep avoiding these foods. I've had patients come into me who literally can eat like 8 kinds of food, right? So that's the fear, that's the problem I see with these tests. So are they always wrong and bad? Absolutely not. I have access to these tests. I use them in my clinic for very specific reasons, and sometimes they help my clinical management. But if you're trying to use that as your starting point on your journey towards health and wellness, I would try to talk you out of it and ask yourself, why do I think I have a food sensitivity? And might not it be better for me to look at why I'm reacting to the foods instead? So I hope that helps. If you have any questions, it's a huge topic. I'd love to hear your thoughts and questions on that. And I look forward to talking to you soon.